Hi, everyone, and thank you so much for tuning into our April Kapnick Drive webinar. Today, we are going to be discussing sustainability and specifically its intersections with our health and overall well-being. So getting started, we are going to start out with a definition here. So just so we're on the same page with what sustainability is, in general, the umbrella term means that sustainability is the ability to maintain a process continuously over time. So again, that's the umbrella term. When we break it down and look at it specifically in the context of environmental sustainability, we can refer to the EPA definition below. So according to the EPA, to pursue sustainability is to create and maintain the conditions under which humans and natures can exist in productive harmony to support our present and future generations. So now that we're all on the same page with what sustainability is, we're going to talk about how it interacts with our health. So just a little disclaimer here, we're really just going to be touching the surface today of what sustainability is. And we also want to, note that we understand this is a very nuanced topic. So really today, our aim is just covering the various ways that our environment interacts with our health. When we think about health, we need to consider the things or conditions that are necessary to support a healthy life. So those things include food, water, power, somewhere to live, and also the ability to receive medical care. If we're missing one or more of those things, it can become increasingly difficult or even impossible to not only survive, but to live a healthy, fulfilled, well life. So again, in this presentation, we're going to be using these factors that are listed on the slide to look at sustainability. How can we sustainably produce and provide food, water, power, housing, and healthcare to ensure that current and future generations have the best chance to enjoy a happy and healthy life? So again, through this presentation, we're really looking at sustainability through a lens of how it impacts our health and well-being. So really how we interact with our environment and how our surrounding environment impacts us. Starting out with sustainable food systems and its impact on our health. So today's global food system produces unprecedented quantities of food. Even with more food than we've ever had, and really more than we need, the World Health Organization estimates that over 1 billion people lack adequate food to satisfy minimum standards of nutrition. The industrial agricultural systems that developed during the past century are increasingly recognized as environmentally unsustainable. And in many cases, they can cause environmental degradation and substantial losses of biological diversity. Nearly 3/4 of all species just in the past century alone. So sustainable food systems, on the other hand, can promote health in 4 different ways. They take care of our environment, they take care of livestock in a way that reduces harm, improve our economic systems, and they also take care of those who are producing the food as well. So when we talk about a sustainable food system being environmentally sound, that means that sustainable farms encourage biodiversity, conserve scarce water resources, and use techniques to care for the health of the soil as well. And of course, healthier soil also means more nutritious foods. Sustainable ranchers raise a moderate number of animals at a time, so not raising more animals than the land can support, and they often rotate the animals around a pasture to minimize their impact. When we talk about a humane food system, sustainable ranches create conditions that are much closer to the way that cows, pigs, and chickens might live if they were just existing out in nature. So animals can have access to the outdoors, of course, and are raised on open pasture for as much time as possible where they can forage and run around and do as they would normally. Even slaughter can be done in ways that reduce stress and create a respectful environment right up to the end of that animal's life cycle. As far as economically viable goes, the best way to support sustainable food is to buy directly from the producers. So this would look like going to a farmer's market, for example, a community-supported agriculture subscription, or a farm stand as well. So, whether it is a physical store, just a stand that collects produce from local farmers and sells it for them. This direct relationship between yourself and your farmers facilitates communication and puts more of the food dollar directly in the hand of the producer. Lastly, when it comes to socially just sustainable food systems, seasonal farm workers in the US earn a very, very low wage, on average around $11,000 a year. So in a sustainable system, we would want to ensure that workers are compensated fairly and treated with respect. Of course, they are the individuals that are putting food in our hands, and it's a huge industry, and we want to make sure that they are being compensated fairly and justly. So with everything on this slide, I'd say the major takeaways here: support local farmers where you can, and also be aware of the practices of the companies that you're buying from. Of course, in an ideal world, we'd all be purchasing from companies that have ethical practices. That's not always reality, but where you can, especially with things like your food products, your clothing, your household cleaners, anything, just being aware of the practices of the companies that you're buying from is really beneficial when we're working towards more sustainable systems. So what could a sustainable food system look like? Sometimes it's hard to imagine doing things so differently from the way that we've been doing them for decades. But you can see on this slide, the top is kind of how we've been doing them historically, and the bottom shows some examples of how it could look different. So instead of miles and miles of single crop fields that have been shown to negatively impact soil health, sustainable agriculture incorporates biodiversity. So you can see even in that picture on the bottom that there's just a variety of crops, trees that are present in that picture. So all different kinds of plant species are present to create a healthier, productive ecosystem that still will grow the crops we need. On the right side, instead of large feedlots that require a lot of space, water, and outsourced feed, livestock can be produced at a small scale and graze pastures on rotation, which benefits both the animals and also the environment that they live in. Next, talking about water and how our water sources could become more sustainable. So according to the UN, water is at the core of sustainable development. It's critical for socioeconomic development, healthy ecosystems, and for human survival itself. It's vital for reducing the global burden of disease and improving the health, welfare, and productivity of populations. So with that definition, you can kind of start to think about all the different things that we use water for to help improve our health. So clearly we drink it to stay hydrated. We shower with it, so it's a big component of our hygiene as well. Brushing our teeth, also hygiene and keeping our entire bodies healthy. Washing our wounds, cleaning our homes, supporting indoor plumbing, and so much more uses that we need water for. The thing is with water is that it's not an infinite supply, and it's really only a renewable resource if it is well managed. So where's water primarily used? Well, agriculture, industry, and energy actually use 90% of the total world's water. So all those uses that I listed, showering and drinking, that we ourselves as the domestic sector use, we only contribute to 10% of the total world's water use. Even just thinking about, as an individual, how much water we use on a daily basis, whether we're drinking it, showering with it, brushing our teeth with it, it's pretty astounding to think that all of us on the world combined doing all of those different things every single day only add up to 10% of our total world's water usage. So even though we only use 10% of our water supply, there are still billions of people without access to water that, of course, is necessary for health and our hygiene. Water demands are only expected to grow as our global population continues to increase as well. So without improved water management, over 2/3 of our world's population could live in water-stressed countries by 2025. There are some available methods to improve our current water systems and make them more sustainable, including producing less agriculturally, especially reducing our meat consumption industrially, and also increasing the efficiency of current systems and also using alternative water systems. We've listed a few alternative water systems here. So some different ones include harvested rainwater, which you can actually do just at your individual level at your home. You can harvest rainwater and use it for different things. Reclaimed wastewater, and then lastly, desalinated water. So that's taking water from the ocean, removing the salt to turn it into fresh water that we can use for drinking water, for showering, other uses. Next, onto sustainable power sources and how they impact our health. So we can break down our power sources into two categories, non-renewable and renewable. Starting out with non-renewable, they are called non-renewable because their supplies are limited to the amounts that we can mine or extract from the earth. In this way, they are not sustainable energy sources because it's not a process that can be maintained forever. If you think about it, the supply is limited. There's only so much we can take. So, when we think about that definition of sustainable as something that can be maintained, a process that can be maintained for a long time, that's why these are not technically considered sustainable energy sources. Coal, natural gas, and petroleum formed over thousands of years from the buried remains of ancient sea plants and animals that lived millions of years ago. That's also why we call those energy sources fossil fuels as well. Some of the impacts of non-renewable energy sources on our health. So with each type of energy supply, there are unique impacts on our health and our environment as well. In the exact communities where extraction of these non-renewable resources takes place, so communities that have coal mines or uranium mines, air and water pollution can impact the health of the individuals that live in that area, and the workers that are doing the mining can suffer from occupational diseases like black lung. Air pollution is also a problem in those areas caused by fossil fuel combustion at coal and natural gas plants in particular, and also transportation related pollution can create health concerns where energy is produced. Waste disposal and radiation exposure are also concerned for workers and individuals living in communities near nuclear plants. So renewable energy sources, on the other hand, are of course called renewable because they're naturally replenished. So every single day we know the sun's going to shine, plants will grow, wind will blow, rivers will run. So in this way they are sustainable. It's a process that's going to continue forever, or at least within the future that we can foresee. Renewable energy development, although it's safer from a climate perspective, does also pose some occupational and environmental health concerns, especially where components are manufactured and installed. So this, of course, can include workplace injuries for individuals working in this industry, or local exposure to carbon dioxide emissions from burning biomass as a renewable energy source. So all in all, when we compare the two, the health benefits of renewable sources of energy outweigh the risks. But however, it's good to look at the impacts of both resources. So housing is another topic that we often don't tend to consider how it really impacts our health, the health of our communities. But good health truly does depend on having homes that are safe and free from physical hazards. So poor quality or inadequate housing can contribute to health problems like chronic diseases and injuries, and it can have harmful effects on childhood development. I think probably one of the most prevalent examples that we've seen in recent history is Flint, Michigan, and what it means to be living in homes that have lead paint on the walls, where the water is not safe to drink, etc. Poor indoor air quality, lead paint, and other hazards often coexist in homes, which place children and families at risk for multiple health problems. Neighborhood characteristics can also promote health by providing recreational spaces that are free from crime, violence, and pollution. So one example would be having access to a grocery store that sells fresh produce, and on the contrast, having fewer neighborhood liquor and convenience stores or fast food outlets, that can make it a lot easier for families to find and eat healthful foods. So it really does depend a lot on what are you surrounded by. Do you have a surplus of fast food chains right next to your house? Or instead, do you have options for farmers markets and fresh produce, however it looks for you. Social and economic conditions in neighborhoods may also improve health by affording access to employment opportunities and public resources like efficient transportation, libraries, parks, and good schools. So with all that being said, the United Nations Human Settlements Program still estimates that 1.6 billion people live in inadequate housing. And the best data available suggests that more than 100 million people have no housing currently at all. So we know that, and we know that our global population is also growing exponentially. So now we're faced with the challenge of how can we sustainably provide housing that supports people's health? So there are a few solutions that we've listed on this slide. First, energy efficient housing saves money and resources, which makes them more sustainable. Green materials can also be used in the construction of home to help reduce waste. Mixed use spaces blend residential spaces, office, retail, and recreation, also small scale agriculture, to create walkable, sustainable communities where a lot of the resources can be locally sourced just within that community itself. In order for housing to be sustainable, it of course needs to be affordable for everyone, which can be supported by policy. And lastly, multifamily structures can make efficient use of land and resources while housing a lot of people in one place. All right, I'm going to pass it over to Lexi for this next slide on healthcare.
Awesome, thank you, Emma. Our next topic in sustainability is healthcare. And the greatest impact of adopting sustainable practices in healthcare is really addressing the environmental and social determinants of health at the source. It's by creating healthy living and workspaces. And the goals of sustainability in healthcare are in 3 areas. 1, protecting public health from the effects of climate change. The World Health Organization, or WHO, forecasts that climate change will cause an additional 250,000 deaths each year between 2030 and 2050. It will also cause between 2 billion and 4 billion in damages to the healthcare industry each year by 2030. So preventative efforts like providing housing and access to food and water can help reduce these impacts. Number 2, the healthcare industry can also contribute to sustainability by transforming the global healthcare supply chain. The purchasing power of the healthcare industry can be used as leverage to promote products and services that are produced ethically and sustainably. And implementing sustainable practices in healthcare facilities such as water conservation, telehealth services, waste disposal practices, and even swapping out disinfectant cleaners can all have an impact on the carbon footprint of a healthcare facility. And some new hospitals are even being designed with energy efficiency and exposure to natural light and ventilation in mind, all of which has been shown to improve the rates of disease and patient outcomes. And then lastly, billions of people globally and millions of people within the United States lack access to affordable healthcare, which can compound the problem of poverty by perpetuating cycles of poor health and expanding out-of-pocket costs. More sick people equals more resources used. So reducing the number of people experiencing illnesses through prevention and healthcare and access to healthcare can therefore improve sustainability. And there are many threats to sustainability currently. This includes climate change, pollution, illegal fishing and wildlife trade, deforestation, overfishing, reliance on fossil fuels, what Emma talked about earlier, loss of biodiversity, soil erosion, excess waste generation, water scarcity, international conflict, and so much more. And because of all of this, it can sometimes make us feel hopeless. But it is important to remember that there are sustainable, science-backed solutions to each of these threats. So what can we do? There are practices that we can start incorporating into our daily lives that can have a positive impact on both the world around us and our personal health. So some things could be buy less and make more mindful purchases, thinking more of your needs rather than your wants, considering reducing your meat intake, using alternative forms of transportation like riding the bus, public transportation, ditching fast fashion and checking out your local thrift store. I know I have found a lot of good options just from shopping at the thrift store, sometimes better than what's currently in fashion. Checking out the local library before buying new, or listening to an audiobook instead of buying a book. Using a reusable water bottle, this can actually save you up to $266 per year. Recycling, which we'll talk about soon, cans, bottles, plastic, clothes, just to name a few. And lastly, advocate. And this can be done by joining a community organization, educating others, or writing or calling your representative. And some of these practices may feel small, but change has to start somewhere. And the more that people practice sustainable, this will lead to healthier lives and a better community for all of us. So now that we've talked about some practices that we can do, I now want to talk about some practices that, even though they have good intentions, they can actually cause more harm. One is called wish cycling, which is the practice of throwing items in the recycling bin that you're not certain can be recycled, or AKA aspirational recycling. And wish cycled items are always sent to landfills and can cause less than ideal situations, including operations halting or slowing as workers hand remove these incorrect items. This is actually a best case scenario, as incompatible items not removed by workers can cause problems. So for example, plastic bags could get wrapped around cogs and clog up the machines, which ends up damaging the machines and endangers the workers. But ultimately, what wish cycling does is diminish the quality of the recycled end products. So even small amounts of contaminants can ruin an entire batch. And once a batch is contaminated, it is unable to be processed. Manufacturers don't want to buy it, and recyclers are just forced to send those valuable materials to the landfills. So if you are doubting if something can be recycled, the best practice is to just throw it out. So speaking of recycling, you may be asking yourself, so what can I recycle? So this is a friendly reminder. You could take a picture with your phone or screenshot it. And this is a great thing to have on your phone. So if you are ever asking that question, you have a quick reference. So some things that can be recycled include metal and glass, plastic bottles and tubs, aseptic containers, mixed paper, and cardboard boxes. And note that items must be clean, dry, and empty. And some items that cannot be recycled include plastic bags and film, styrofoam like from egg cartons, batteries and electronics, textiles, and light bulbs, to name a few.
One tip, this is Emma jumping in, but I wanted to highlight on this slide that I learned a few years back and has been really helpful as a rule of thumb for me. Generally, when you have, a plastic container of some sort, I included an example of a Trader Joe's salad in the right corner on this. You have the plastic tub, and then you kind of have that flat plastic lid that goes on top of it. So as you can see on the yes, what you can recycle, plastic bottles and tubs are included in that. What you don't see is, flat plastic pieces. So generally a good rule of thumb, if a plastic tub that your food comes in, any other product comes in, if it doesn't have as much depth as about a yogurt cup, so just like a small yogurt cup, it can't be recycled because there's just not enough product to recycle it and turn it into something else. So if you have like a salad container, like I showed in an example in the right corner, if that tub has some depth to it, you can recycle that, of course, if it's clean and dry. But what you would do with that top flat lid, you just throw that out because it can't be recycled.
So this information on the slide, it comes from the city of Ann Arbor in Michigan. So I encourage you to check out your local recycling center's website to see what information that they have on there. So now we're going to talk about greenwashing. And this is the process of conveying a false impression or providing misleading information about how a company's products are more environmentally sound. Greenwashing is considered an unsubstantiated claim to actually deceive consumers into believing that a company's products are environmentally friendly, often encouraging consumers to pay more for a quote-unquote cleaner product. So just because a product uses green colors, nature motifs, or even calls a product pure or natural does not mean that the product is sustainably made. It's not environmentally friendly or it's healthy. So where we spend our money can be just as impactful as recycling or advocating for change. So it's important to support businesses with sustainable practices where we can. So individual efforts are a great place to start practicing sustainability, as we talked about earlier in the presentation. But the change necessary in order to ensure healthy, happy lives for future generations of Earth's inhabitants has to happen on a much larger scale as well. And sustainability isn't political. It's a shared global goal that gets us thinking about how to preserve the world and its resources for future generations. Because at the end of the day, we are all citizens of planet Earth. And the United Nations has global goals that are set of 17 commitments made by 193 world leaders, including the United States, to end extreme poverty, inequality, and climate change by 2030. Even with good health and well-being is goal number 3. So if all other goals were achieved, health would naturally improve for current and future generations. And we can all be agents of change in considering and designing sustainable outcomes in the world around us that affect systemic well-being, socially, economically, and environmentally. And when we frame sustainability as a practice that helps us create a future that we're excited about living in, we create optimism about solving complex problems, which is what's required to truly tackle all of these issues. So for one of our last slides, we kind of just touched the surface about a bunch of topics on sustainability. So if you are interested in learning more, here are some sources for you. We have a couple of books called Climate Justice, which was actually written by the former president of Ireland and was the United Nations High Commissioner for Human Rights. She also was awarded the US Presidential Medal of Freedom for her work in fighting for human rights. There's another book called The Sixth Extinction. And then we have a couple of podcast options, so Sustainable Mind Podcast or the Environmental Health Chat, which is actually partnered with the National Institute of Environmental Health Science through NIH. And this podcast explores about how environmental exposures affect our health. And so each episode highlights different research, community groups to understand and address environmental health issues. So we also have a TED Talk, and if you did want to learn more about the United Nations goals, there is the website right there. So check them out if you're interested in learning more and diving deeper into today's topic. And lastly, thank you everyone for joining us on April's monthly wellness presentation on sustainability and health. We hope to see you next month for our May wellness presentation on arthritis awareness, which will take place on May 25th from 12 to 12:30 p.m. Eastern Standard